Welcome to another lesson by BeWell. Module Telehealth. Shaping the health and care workforce of tomorrow. The BeWell project addresses the need to prepare the health and care workforce for green and digital solutions introduced in the European health and care systems to ensure they can respond to current and future challenges. Hello, here we are talking about telehealth again, and in particular, Televisit. Together, we will better understand what it is and how it can be useful in our work, the main applications and challenges that can be faced. In this in-depth discussion designed for those who have already successfully implemented it, you can compare notes on the key aspects and best practices for implementing an effective and appreciated telemedicine process. So let's get started.
Hi, and welcome to this lesson. As we have already covered in previous lessons, telehealth refers to a mode of delivering healthcare services through the use of innovative technologies, particularly information and communication technologies, in situations where the healthcare professional and the patient, or two professionals, are not in the same location. Televisit, in particular, is a medical act in which the professional interacts with the patient at a distance in real time, also with the support of a caregiver. Televisit, as also provided for by the Code of Medical Ethics, can never be considered the sole means of conducting the doctor-patient relationship, nor can it be automatically considered a substitute for the first in-person medical visit. The doctor is responsible for deciding in which situations and to what extent televisit can be used in favor of the patient, also using telehealth tools for remote detection or monitoring of biological parameters and clinical surveillance. Televisit is limited to the follow-up activities of patients whose diagnosis has already been established during an in-person visit. And now, let's try to get to know all the main aspects of Televisit better. Televisit is an health action in which the healthcare specialist interacts with the patient in synchronous and remote form. It can lead to drugs or examinations prescription. The support of a caregiver may be needed during the televisit. So, which are the main healthcare issues during COVID-19 pandemic? Accumulation of outpatient visits. Need for continuity of care of the patient to prevent acute events. Reduction in the capacity of the centers, for example reassignment of rooms and staff. Impact of the new strengthened protocols of management and safety. Need to minimize the risk of contagion. Welcome to the new era of video creation with Hey Jen. Simply type your script to get started. So what the televisit is useful for? Evaluation of clinical stability in a known patient. Screening for the need of an urgent access to diagnostic and therapeutic interventions. Request a further radiological examination, blood test or specialist consultation. Confirmation or modification of the drug therapy, check of the recently introduced drugs, up-titration of drug therapy. Production of a digitally signed report, which is delivered to the patient at the end of the televisit. What it is not useful for is Provid certificates. And now, some important aspects to take into account. The Televisit should be inserted into a well-organized system which has been approved by the health authority. The activation of the service of telemedicine requires the consent of the patient or of an authorized relative. The Televisit should be inserted into an organized and approved system. The interaction between the patient and the health professional must be synchronous, in order to allow the medical doctor to see the patient and to interact with him and with the caregiver. Which is the patient profile suitable for Televisit? Patient with known diagnosis. No limits of age. Support of a caregiver during the Televisit, relative, friend, health professional or family nurse. Absence of cognitive impairment, if a caregiver is absent during the Televisit. Average ability of the patient or of the caregiver in using electronic devices and technologies. Availability of a personal PC and/or a smartphone, internet connection, webcam. Availability of device devoted to measure clinical parameters, like sphygmomanometer, saturimeter, or other electronic devices.
In this lesson, we have seen what telemedicine is, what it is used for, and in which situations it can be applied. We have also highlighted some important aspects and the type of patients it can be effectively applied to. In the next lesson, we will see how to implement a telemedicine service. Thank you for your attention and see you in the next one.